in Rome, and the list can go on. You get the gist. Good morning. Well, it's 9:20, and this has been right, Bob. This has been a joke. This treatment. I've been getting up at 7:30, 8:00. Yeah, sure. And they're still not come, so had to be up a little bit earlier today anyway for my son. But yeah, I hate the waiting game. We're on we're on day eight of medication today, so we're flying through it like Father Christmas in the snow, really. And I'm wearing Father Christmas's outfit, but yeah, I'm starting to pick up now, guys. It took a while. It took about 4 days, and I started feeling the effects of the medication. Then I had a little bit of a dip here and there, and every day I feel like I'm having a little bit of a better day. And my sleep hasn't been great the last 2 nights. So I'm hoping to get better sleep. I was taking my amitriptyline about 7:30. It was knocking me out about 9:45. So I'm going to start going back to taking it that little bit earlier. What else to report? There's not really much to report, really, apart from I'm waiting for my nurses. It's gone smooth this cycle. It's gone pretty well. I've not had any nurses that do me head in. Some of them haven't taken too long. On the first day it takes longer, and then yesterday they had to do the blood. They had to repeat the blood test yesterday. So yeah, just it is what it is, guys. I don't need to ask about what my bloods are saying because they normally tell you anyway. But at the start of your meds, it's very important that they tell you what your bloods say and what your sputum sample said. And that's what pisses me off, because the patient, is it the nurse and patient thing I'm looking at, interaction should be a lot better than just coming to do your medications. They should be updating you, even if the bloods are satisfactory. They should be updating you and telling you what's going on. So I had to chase things up. It went on to about day 4, day 5, and I kept asking one of the nurses, "Can you tell me what my blood's saying?" Some of them didn't come with a laptop. So by day 5, by day 5, I actually phoned up and I got my results. So is what it is, isn't it? Because nothing else you can do. But yeah, we've got an idiot there. I don't know what he's doing. He's been blocked. So got my hair cut yesterday. Just because I felt like I was getting a little bit more, not back to normality, but I thought my beard was getting too long, my hair looked crap, so I had an haircut. It picked me up a little bit, nothing's happened much, mate. I'm just waiting for my nurses to come. Just chilling out, and I'm bored, so I thought I'd do a quick live. So yeah, we're on day 8. We've not got long to go. Try to think. We're on day 8. Finishing about, is it 6 days? Yeah, 6 days I finished my antibiotics. I'll switch the camera around here a bit. So here's my meds. You can't really see it. They come in these storage boxes here. So yeah. Yeah, it's a lung condition, mate. It's bronchiectasis, bronchial sepsis of the lungs. So I've got, colonisation of bacteria that grow in the lung, and they need special treatment. Because we have something called the rapid response team or something like that over here. We don't need to go into hospital to get the treatment. They come out to you. So over here, I've got don't know if you see it, big needle in my chest. It goes into a port, and then I'll get this out. And then they come and they just take that cap off, and then they give me medication. So that port always stays in the chest, and it just needs needling. And this is for people on long-term treatment. But yeah, I'm not going to bore you anymore. I just thought, why not do a live? I'm waiting around. They've been coming round about 10:30 in the morning, and then they've been coming about 7, 7:30 at night, like clockwork. Yesterday they come a bit earlier, about 5:30. So yeah, and the good thing is this time around I've not had many students come, because it gets a bit boring. You know, in the beginning, you're not bothered about students coming with the nurses, but then, you know, it's the same recycled stuff, and you're having to deal with 2 people, you can't be bothered, you're not feeling well. So I'm glad they've not come with many students. How did you first get it? I think I always had it, mate. I think I had collapsed lung when I was a baby. And then throughout my childhood, I was very skinny, didn't want to eat, always brought green mucus up. And then 2009, I got a pneumonia. I had a CT scan and it showed the bronchiectasis. So I'm never going to get better. I mean, I'll pick up. You know, I might have a good few days here and there, maybe a week. But as you get older, it's a progressive lung disease, like any disease. It progresses with age. So it is what it is. I'm 38-year-old. You know, most people with cystic fibrosis don't get past that age. I'm lucky that with bronchiectasis we can live to a good age with the right treatment, kind of thing. So yeah, everyone's path's different. You know, people with bronchiectasis, they try to label him as bronch patients, but it's wrong, because my letter actually reads bronchiectasis, bronchial sepsis. I know 2 people who don't read that. So, you know, when you're talking natural remedies, mate, I'm high on supplementation, eating good foods, things like that. You know, try and keep myself well outside these. But I also have daily gentamicin, which is like a mask on the face. So I've got to have daily antibiotics, because if I don't, what can happen is I'll just get very poorly. So even after I finish these, I sometimes try and have a week or 2 off, but then I just become poorly. If I go longer than 2 weeks without any antibiotics, I get very poorly. So right, I'm gonna go anyway, guys, because my parents have came down, and I just thought I'd throw a quick live out there. Take it easy.